Thank you, everyone. Really appreciate you all making the time, and we're really excited for the discussion that we'll have today. As I'm sure is no secret to all of you, both patients and caregivers face often overlooked challenges from just treatment side effects, emotional and lifestyle adjustments. And oftentimes, what that ends up doing for patients and their loved ones is invoking a feeling of abandonment. So we're very excited to have Dr. Bailey-Dorton and Carolyn Knudsen here today, who are uniquely qualified to talk about the challenges of cancer survivorship. Dr. Bailey-Dorton is the co-founder and medical director of the After Cancer. She's a 22-year breast cancer survivor and has a background as a family practitioner and completed a fellowship in integrative medicine. She led the integrative oncology department at Levine Cancer Institute for over a decade, and she currently guides the After Cancer's clinical approach and is the director of survivorship at First Health in Pinehurst, North Carolina. Carolyn Knudsen is the co-founder and COO of the After Cancer. So we're very excited to welcome them, and floor is over to them. Thank you so much.
Well, thank you so much for having us.
There's the housekeeping things. There are three things we always say at the beginning. This is for information purposes only. This is not medical advice. And second, everything will be made public. So if you're concerned about your image being made public, you can change your name and turn off your screen and don't say anything. And then the third one is we are a nonprofit 501c3, and we depend on the kindness of people making donations. So if you're so inspired to make a donation, we would greatly appreciate it. It's easy to do if you go to our website and click on the donate button. Sorry for that interruption.
No, good flag.
Back to you.
Thank you.
I think we can abide by those three rules. So thank you for having us. As you said in the introduction, as I tell patients, nobody knows what it's like to hear the word cancer or go through treatment unless you've been there. You know, I've been there. I always say that most times in life, you feel bad, you go to the doctor, they do something to make you feel better. For cancer, the treatment we get makes us feel worse than when the whole thing started. And we're always wanting to know, what can I do? So anything I can do to decrease side effects, anything I can do to help my body fight this, anything I can do. And as scary as it was at diagnosis, I think it's even worse when we get towards the end of treatment. The thoughts are, I didn't know I had this. Is it going to come back? Why did my body fail me? Will I know if it comes back? And can I do anything to keep it from coming back? And, you know, I went through those things myself, and that's what led me to Integrative Medicine Fellowship. And so when I meet with patients now, I tell them, my job is to load the boat with everything possible to help you without sinking the boat. Meaning there's a lot of misinformation on the internet. There's always somebody trying to sell us something. They face all their family and friends saying, well, I read this, you should do that. And we got to make sure we're not interfering with what treatment that they have. So we want to put that plan together. And I think we're going to show some slides here in a minute of what we really face when we get to the end of treatment. Carolyn, can you put that first slide up for me? So this is something we kind of modified that I'd found on the internet. This talks about this iceberg. So we get to the end of treatment, and what people say is, oh, your hair is growing back. You're able to go back to work. You're back to normal. You're so strong through this. Aren't you great? But what they don't see is what we're dealing with underneath the water, underneath that iceberg. That fear, that feeling where we'd been seeing our oncology team every 4 to 6 weeks, and now it's, well, I will see you back in 3 months or 6 months. You know, the neuropathy, the fatigue, the change in our body, the loss of mistrust in our body, and then this overwhelming, you know, this fear of recurrence. I always describe it as cancer is the big elephant in the room. So I'm 23 years out. The elephant's still here. It's small and it's in the corner, and there are times it wants to grow. And a lot of survivorship is learning how to control this elephant when it wants to grow. And we've got to process through what we've been through. And also, survivorship has changed. You know, we now have folks who are going to be on treatment for the rest of their life. And sometimes they feel like they don't fit in this paradigm that we have, but they're still dealing with a lot of the issues. And so I think these things that are under the water and the iceberg are not dealt with enough in our clinic and for our patients. Next slide. So we mentioned integrative oncology, and I really think this is how we deal with survivorship. This is where integrative oncology starts at diagnosis, getting in there and really addressing the physical, the psychological, the social, and the spiritual aspects of this patient. Many times when that significant other's in the room, I'll turn to them and say, "How are you?" And they're like, "Well, no one's ever asked me that before." How do we optimize that healing process? How do we minimize the side effects? How do we maximize recovery? And how can we decrease the risk of recurrence? There's a great analogy of mold in a basement. So, you cut the mold out, you radiate the basement, you maybe put chemicals in the basement. But if you don't change the basement, the mold's more likely to come back. And so how can we help decrease that risk? How can we give some control back to that patient so that they know they're doing something? And how do we incorporate evidence-based complementary therapies? And so this gap is really where the after cancer is able to come in and address some of these issues. So I'm going to turn it over to Caroline and let her kind of explain what we do.
Yeah, thanks, Bailey-Dorton. So that's really exactly what we do. So cancer-free doesn't mean healthy, and that's what was the birth of the after cancer, was from that realization and personal experience, and as a clinician for Dr. Bailey-Dorton, as well as our co-founder and CEO, Mariana, who was a 8 times over now cancer caregiver. So what do we do in this space after cancer, and how can we support in that gap? Because the consequence, as all of us know, of better cancer treatment, which is brilliant, but it does mean that there's more diagnoses, there's younger patients who are being identified earlier, and there's longer and higher survival rates. And so there's an increasing population of patients with all those needs. We talked about what's kind of under the surface there in the iceberg image. And our healthcare system hasn't caught up to really support in that space. And so that's the gap that we're trying to help fill at the after cancer. So this is a use case, Mary, a 31-year-old breast cancer survivor, but is just as true of all of the users who come to our platform. And this quote is really indicative of that experience as well, is I'm more scared now than the day I was diagnosed. And it's really because in that space after treatment, that really strong multidisciplinary team and support is gone, and patients are often having to navigate that alone. So what we're trying to do with the after cancer is help patients like Mary find evidence-based answers to those day-to-day questions of all of the things we just saw earlier, but here more specifically in this use case, questions about drugs you're taking post-treatment, so things like tamoxifen and the impact that that has on patients, what to eat, nutrition, what's safe, what's not safe, questions about feeling isolated and lonely. Loneliness is huge for people, and changing dynamics within relationships and how to manage that. We talked about fear of recurrence, how to manage fear of recurrence, and really help patients live in between scans and manage scan anxiety when those moments of monitoring come up. And then to manage those frequent questions that come up around both the physical as well as the psychosocial things that are sort of day-to-day needs for survivors. So we do that with our virtual survivorship programs. I mentioned a little bit earlier, it's available in all 50 states. For us, it's really important increasing access to this kind of support. And so that digital first approach was fundamental for us. And these are sort of the core resources. So there's personalized support to give guidance to patients on what they should be exploring in their own journey, and also based on their interests and their own concerns that they self-report. There's educational resources that are sort of available asynchronously, so they can do this whenever and wherever is convenient to delve in and learn more. There are group sessions, so this works just kind of like a gym membership. There is something every day for them to attend in a group setting, and these are both complementary therapies and practices that promote well-being, but also chats with experts. So we try to bring experts in as much as possible so that they can have that direct impact. And we're trying to manage also some of that fatigue around appointments, but still get those answers. Circles is what we call our communities. So we have patient communities on topics. And then finally, one-to-one chats. So really trying to help people stay away from the WebMD and the going to Google when they have questions, and come to us where we have a group of 14 practitioners who are experts who can get the answers they need in real time. So it's just important to note for us that measuring that impact has been something that's important for us as well. So this was a 6-week study. We measured patients before and after participating and having access to these group-based integrative approach resources. And the results are on the left. We presented this at SIO last year. Dr. Bailey-Dorton did. And in just the 6-week period saw this impact. So reduced burden in terms of overall symptoms, decreased reported symptoms of depression, and increased sense of normalcy. But really important is really the quote on the right from one of our patients, Lauren, who spoke to exactly what we saw earlier in the iceberg. You may look better, and there's an expectation that after treatment you're really done, but that's just not the case. And so what we're really hoping to do is support patients in that in so many different ways, reported outcomes and otherwise. So that's really kind of what the After Cancer does. Dr. Bailey-Dorton and I are here for questions and answers, and then just know that you can always reach out to us as well. We're thrilled to engage with this community and this ecosystem.